Welcome back to this discussion on health and on emergency response. We have simulated various scenarios that might happen at home or when you're traveling that may need an emergency response. And what we simulated was how to do a resuscitation in an adult, how to do a resuscitation in a child, how to help a child who is choking, what to do in a traffic accident where somebody is suspected to have spine injury, and what generally to do in that scene of a road accident, what to do in a bleeding patient in order to stop or to prevent a lot of excessive bleeding so as to save a life. And with me on studio to discuss this is a team from Kenya Red Cross. I have Dr. Abbas Gulet, who's the Secretary General of the Kenya Red Cross Society. I have Dr. Modhoni Ntonjira, who's the Medical Director of the Kenya Red Cross Society. And just before we went on break, we were looking at the various regions, how diverse the country is and how some areas are hard to reach, and emergency services, emergency medical services may be a challenge in some of those areas. And so my question to you, Dr. Abbas, is how difficult or how easy is it for you as the Kenya Red Cross to offer emergency services in these far-to-reach areas, the arid and semi-arid areas, the underdeveloped areas where people live and still need these emergency services?
So I would say, Dr. Ari, that it is not easy, but it's also doable, and it only requires for us then to wanting to do it. So, for example, I'll give you an example. Kenya Red Cross today manages ambulance services for 6 counties, Mandera being 1, Garissa being 2, Kakamega, Bomet, Narok, and we were doing Kisii previously, where the county government contracted us to run ambulance services for them. Kakamega, for example, we had 11 ambulances. No, Narok is 11, Kakamega is 9, and Bomet is 6. Mandera is 7, Garissa is 7. So we run ambulance services for them, and these counties vary in size and in geography and in terrain. For example, Narok is a vast county. Mandera is one of the biggest counties. If you look at Kakamega, it's densely populated, but distance is not very far. Bomet is the nearest or the smallest in terms of geography and size, whereas Garissa is also far. So when ambulances are put up in divisions, in sub-counties, locations, some have to do 200 kilometers of that road where there's no road. In Mandera, or even Marsabit, where we have an NHIF ambulance leased by NHIF. So in the far-flung areas from West Pokot to Turkana to East Pokot in Baringo to Samburu, Marsabit, Isiolo, Mandera, Wajir, Garissa, Tana River, these are what you call the arid and semi-arid counties, and they're very difficult because there are no proper infrastructure, there are no tarmac roads. So Mandera to Nairobi can take 2 days, a good part of 2 days by road. So when we have emergencies, like we've had terrorist attacks many times in Mandera, we are forced to fly. We can do the ground ambulance from the scene of the accident to the airport, and then from the airport here, fly patients to Nairobi by using our own paramedics from E+ and air ambulances that we have to lease in the plane. The same thing with Marsabit. We've done this many times in Marsabit. We've done it in Samburu, we've done it in Turkana. So for those areas, because it's a matter of life and death, when there have been tribal clashes, ethnic clashes, or terrorist attacks, people have bullets lodged in their bodies, there are fractures and multiple fractures, then the best way is even those hospitals out there are not able to treat them. Some may need ICU facilities, so the only way is then to fly them to Nairobi, and that's what we do most of the time.
Okay. And Dr. Modhoni, from the description, the ambulances are all over the country, and you have one central dispatch center, which is here in Nairobi, and calls come from all over the country. What vital information, I know we had discussed this, but just reiterate again, what vital information should somebody tell the dispatcher who's also well-versed in emergency medicine? What information should they tell them in order to save time for the patient that they are calling on behalf of?
Okay, thank you, Mercy. So what we normally do is we'll take the patient's details, we'll take the name of the caller, we'll ask the person to tell us where they're calling from and the condition of the patient, whether the patient has collapsed, whether the patient is bleeding, whether the patient is having a seizure. We'll need that description. Sometimes the caller might hang up almost immediately. They tell us, we are at this and this place, send an ambulance, and they immediately hang up. So what our dispatch team does, based on the protocols that we have at our dispatch center, is that they immediately call back. And when they call back, the information that they need is to find out how many victims are there to begin with, what is the condition of either the one victim or the number of victims that are there, who is a caller at the scene, or is it, sometimes it can be a bystander who has called and is actually just passing and doesn't have any more information. Yeah? So we normally insist that if you can give us even that little information of how many people are injured or who is the casualty, the age of the casualty, whatever the condition, the nature of the emergency, and your location, those are vital. Yeah? The rest of the information, we are able to gather it from the ambulance once they respond. And the reason we insist on getting at least the number of people injured, the nature of the emergency, is because, like Dr. Abbas had mentioned earlier, we have two types of ambulances. We have a basic life support ambulance, we have an advanced life support ambulance. And for us, we need to know, are we going to send the advanced life support ambulance for a more critical patient, or would a basic life support ambulance be sufficient? And then for us, we would, of course, dispatch the nearest ambulance, and then the first team to arrive at the scene now will call back the dispatch center and give them more information regarding the nature of the emergency, what interventions they've carried out at the scene, whether they need backup or not. This happens a lot when there are multiple casualties, particularly in road traffic accidents. We'll normally send the nearest ambulance, but based on the number of patients, they might need help. So we'll send backup ambulances to assist. Or if there is a critical patient, then we'll send an advanced support ambulance to intercept and now take over from the basic life support ambulance.
Okay. Yeah. And there's one of the habits that I think most people do is when they call the dispatch center, I have an emergency, send me an ambulance, they hang up, then they are calling other people to inform them of the situation. Yeah. And when you try to call them back, their number is engaged. Does this also happen to the dispatch center?
This happens a lot of times, and it's such a huge challenge for us because we're not able to call the only number that has called us, yeah? Because the person is busy calling other people, so the line is engaged throughout. What I'd like to insist and urge Kenyans, when you call for an ambulance, please give the vital information on where you are, the nature of the emergency, and the number of patients who are injured. Stay on the line, or if it's difficult to remain because maybe of airtime issues, we always call you back. If you need to be called back, just tell us, please call me back. We'll call you back immediately. And the information we need is, once you've told us the nature of the emergency, like we demonstrated earlier, if a patient has no pulse, we can actually give you what we call pre-arrival instructions. And these are instructions we give you on phone as you wait for the ambulance to arrive. And you can actually be performing some life-saving skills on a patient as you wait for the ambulance to come in. We all know the nature of our roads, so sometimes we can be stuck in traffic. Yeah? And it may take us maybe 15 or 20 minutes, and it's a patient who's collapsed. So you can see this is very vital time, critical time, that you as a caller can actually be doing something as you wait for the ambulance to arrive, and the medics to take over from you from that point.
And one of the other scenarios that the dispatch team mentioned was several relatives calling over the same patient.
Yes.
And one may actually cancel. We have gotten an ambulance and cancel, yet it's the same ambulance that they were calling for. So how do you maneuver this, Dr.
Yes, it does happen. And but what I encourage my team, and one of the protocols we have, is we have to ascertain who is the next of kin. Yeah? And once we've ascertained from the next of kin that they do not need the ambulance, then we will, call down, recall the team that is supposed to respond. Or in some circumstances, we'll actually have them, if they're already close to where the scene of the incident is, they'll actually go in, assess for themselves whether an ambulance is required or not, and then leave the scene. Yeah. So at times, if we're close to the scene of the incident, we'll actually just get there and see what is needed. If we're not needed, then we're going to leave. But what we normally encourage is whoever initially called for the ambulance is the best person to cancel for it. Yeah. Okay. Or whoever is actually with the patient at that time is the best person to cancel the call.
Okay.
Yeah.
Okay. Dr. Abbas, with all these challenges, reaching all areas, trying to reach all areas of the country, having 130 fleets of ambulances and all the staff, what does it take to run this emergency medical service?
Well, it requires seriousness. For us, the ambulance business was set up for two goals. Goal number one is to provide world-class pre-hospital care for any Kenyan who may need it anywhere in this country. Today, ideally, we would need about 300 plus ambulances for us to be comfortable that actually we have enough to cover this. We also need to have more, as I said, hospitals that have ICU facilities or have trauma facilities. If not even hospitals, there could be even trauma centers or trauma clinics that can be set up in strategic places in this country where we have the black spots for road accidents. Further than that, for us, so that was objective one. Objective two was to say that as Red Cross, this is a business for the Red Cross, run professionally and commercially, but no Kenyan will be denied of ambulance services by Kenya Red Cross, whether they can pay or not. We are also doing this to charge for the services so that we can plow back into the humanitarian work of the Red Cross. Kenya Red Cross is enacted by Act of Parliament, auxiliary to the government, now auxiliary to county governments. Whenever there is any disaster, people expect Kenya Red Cross to be there. We're supposed to be financed by our good government. Today, unfortunately, we are not. But then we have to learn to fend for ourselves. So it's a business venture being run professionally and managed professionally with over 300 Kenyans who are working there. It's not it's not a piece of cake to run this. It is a serious business because it's about people's lives and every minute counts. So I'm very happy that it's a Kenyan local company set up by the Kenya Red Cross, run and managed by professional young Kenyans. What is going on for this country is we have highly qualified people. Unfortunately, we're not able to tap them or get them to do what they need to do and give them the space to work. So what our E Plus does, it has its own board and its own management. It's a legal entity. Kenya Red Cross owns it, but Kenya Red Cross doesn't interfere with its day-to-day management. There are protocols, procedures set up by the management of the company, Marcy being one of the senior staff. Sorry. I gave you some work, so
yes.
You have to give it back to her. Sorry, Mudhoni. So Mudhoni gets back her work, but she's the medical director. So she's the one who manages the technical team in terms of the paramedics and the EMTs. And then there's a team that manages the operation. There is a managing director who manages the entire company. So it's been run very well, I would say, and we're very proud of the successes that they have done and the awards that they have won. They have taken patients from here to Europe, patients from here to India, patients to South Africa, from South Sudan, from Ethiopia. So they've gone distances on air, and it's something that they've done very successfully. And even from Somalia to Italy, they have taken patients. And so I would say it takes serious management, serious board to manage it, and it's been managed very well. I just want to say one other thing, that today there are many people who are masquerading to be running ambulances in this country, private, individual, hospitals, and others. But what is also lacking in the country, and I know we've been working with the Ministry of Health on this, but it's not yet been, officially gazetted. We don't have, an ambulance policy in this country. And we need to have policies. We need to have a regulator also, for that matter, to regulate this industry. Because I remember a couple of years ago, a patient waiting for a bed in Kenyatta for 18 hours. Yeah. Yet the so-called ambulance that was transporting that patient was a transport vehicle. Okay? But I would say today, if they were in an ALS ambulance, that patient could have actually been treated in that ambulance. So this is the other thing, and I would say all of us who are in this space of ambulance services, we need to come together and we need to work with the government. We had actually developed basic policies, but they have not yet been formalized, and this is something I hope now going forward is something that the Ministry of Health will take the lead and formalize it as soon as possible, because it's a basic right that Kenyans should have around the country.
Okay. And you mentioned the Ministry of Health, and NHIF comes to mind, where they've been saying that NHIF members can actually get the emergency E-Plus services. Yes. Is this the case?
So it is the case, but I think with qualification, first of all, this has been a journey, and we started this journey about 3 years ago with NHIF, where the first beneficiary of these services were the disciplined forces and civil servants. So they get both ground and air ambulances. Kenya Red Cross has been providing the ground ambulances, whereas AMREF have been providing the air ambulances. But air ambulances is largely for the disciplined forces. This is something that the HE himself had been very keen about, and he's the one who actually launched this product. In the last, from May this year, I think the last 7 months, we've also now have had additional and when I talk of civil servants and disciplined forces, we're talking roughly about 226,000 principals and their families. So we have had additional 1.7 million that was a principal contracted to us, NHIF members, principal that were contracted to us from May this year. So it's been on for about 7 months. We know that NHIF has a global figure of between 6 and 6.5 paying members, but we are told that the regular payers are probably about 5 million. So we are now in discussion with NHIF to now increase the number so that more and more can be reached. So I would say in all the 47 counties, we have an NHIF-funded ambulance by Kenya Red Cross.
Okay. Dr. Muthoni, from what Dr. Abbas has highlighted on, it's a journey, and it's not quite easy to run the EMS. From your point as a medical director for this emergency service, what does it take for you to actually keep it going on a day-to-day?
I think one of the key things that we needed to establish, and we have established, is a system, and a system of protocols. Yeah? So we work under certain guidelines that we set for ourselves. So we have medical protocols that we work under. We have emergency medical dispatch protocols. We have operational protocols. We have logistical protocols. And all this come together in creating a system where we are very sure of whatever scenario that we need to handle, and whatever part of the country that we are at, we are able to handle it seamlessly. Like Dr. Abbas has described, of course, in some circumstances, we're not able to only offer, especially considering the nature of the emergency and the condition of the patient. We also have to provide air ambulance services as well. And the fact that we're in every part of this country, in all the 47 counties, then it makes it easier for us to even access the patients in the remotest part of this country. And one of the key things that we also do is that our staff undergo continuous medical education, continuous training. We have the short medical courses, the advanced trauma life support, advanced cardiac life support, pre-hospital trauma life support. All these courses keep our medical staff at par with the practices as they are right now. So we really emphasize on the short resuscitation courses for our staff, and ensure that even those who work for us are very clear on what is expected of them, and having proper systems that run within the organization, then make it an easier service. I know when you talk about it, sounds a difficult task, but having systems in place actually makes things run quite smoothly as far as we are concerned.
Thank you. I just want final closing comments from you.
So for me, I mean, I just want to really thank the staff and the management and the board of E+. But to say as a nation, I think we're at a crossroad in terms of emergency pre-hospital care. There's a lot of actors and players all over the country, but which I believe we need to be better coordinated, better managed, so to better respond to any Kenyan or non-Kenyan in this country that would need these services. And I think this is where the government should come in and provide the framework for coordination and for also regulating this. But more importantly, that really is to say that for me, E+ has become of age, and today the Kenyans can feel at ease that they can call E+ at any time, and they can be sure that they'd get the best professional service they could get anywhere in the world. So it's just also to thank you for having us this evening and to sharing this information with our countrymen and countrywomen.
Thank you, and thank you very much for making time this evening to discuss quite a very important issue on health, which is on emergency medical services. And as you said rightly in your E+ motto, time is life. And if you can manage to save as much time as possible for a patient, then that is a life saved. Thank you for tuning in this evening for this discussion on emergency medical response. With me in studio was Dr. Abbas Gulet, who's the Secretary General of the Kenya Red Cross Society, Dr. Modhoni Ntonjira, who's the Medical Director of the Kenya Red Cross Society, and we looked at various scenarios that may happen or may arise, especially during this holiday season, that may need an emergency medical response. We simulated them, and we also learned that, well, the emergency medical service from Red Cross is available anytime, anywhere. They are present in all the 47 counties. And in case of an emergency, if you need to reach them, you can reach them on 0700 395 395, 0738 395 395, and their toll-free number, which is 1199. And that's where I wrap it up today on this discussion on Health Digest. Until next Saturday, when we discuss yet another topic that is important and is vital to your health. I'm Dr. Mercy Korir, and I wish you a very good night and a blessed Sunday and a blessed week ahead.